We're going to talk about the best Medicare supplement plan for 2023. And the great thing about staying with original Medicare, Part A and Part B, is it's really not all that complicated. So we just need to pick the right plan that fills in the gaps for what A and B do not cover. So it's really not all that complicated. But I'm going to go through right now what I would do if I were choosing in 2023 the right plan for the Medicare supplement, also called Medigap. So it's the same thing. I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. Can absolutely help you as well. We're going to talk right now about the best Medicare supplement plan going into 2023. Now, if you stay till the end, I'll also show you how to download my book for free, Medicare Made Clear. Super helpful to have, and I'll show you how to do that right at the end of the video. Right now, we're going to talk about the best Medicare supplement choices in 2023. And again, the great thing about staying on original Medicare is it's pretty easy. There's not a lot of things we need to consider. We don't have to figure out if our doctors are in network or if our hospitals are in network, whether that plan will cover us for that type of situation. With original Medicare, there are no networks. So you can go to any doctor, any hospital, anywhere in the country. We don't have to figure out if one is in network or if one is out of network. And God forbid, if our doctor leaves the network, we don't have to worry about things like that. So on a Medicare supplement plan, it's going to cover stuff like Part A deductible, Part B coinsurance. It covers the big gaps that A and B do not, where when we have a Medicare supplement with A and B, very little out of pocket for the year. I'm going to show you exactly how all that works right now. In the past, there has been one plan that was kind of considered the Cadillac of all Medicare supplement plans, and that's Medicare Supplement Plan F. And this is a plan that covered 100% of everything. So whatever A and B did not pay for, Plan F did pay for. And it was easy to sell from an agent standpoint, so a lot of agents would just sell this plan regardless of how much it cost as being really the end-all of all supplement plans. So that kind of changed in 2020, where if you turned 65 after 2020, Plan F is no longer available because in the insurance world, it really doesn't make sense to have something that covers 100%, where there's no out-of-pocket to the consumer. The out-of-pocket kind of keeps everything in check. So that's no longer available, but that's okay because I've been doing this a long time and I rarely sold Plan F because it didn't make sense financially from a cost standpoint where you have better options. So now really it comes down to a choice of two, really Plan G or Plan N. And that's really the two choices that we're going to talk about right now. And it's pretty simple. Plan G, fantastic coverage. It has only a small deductible, so it does not cover Medicare Part B deductible, which in 2023 is going to be $226. And that's it. Your entire out-of-pocket for the year on the medical side would be $226. So you can look at it where Plan G, once you pay that $226, it turns into Plan F, covers 100% after that small deductible. So I don't know anybody coming into Medicare that has a smaller deductible on their health insurance than $226. These days we have deductibles that are $2,000 and $3,000, sometimes even much higher than that. So that's a very good option to have. Now Plan N, also very similar, and the beauty about Medicare supplements is they're standardized, so it's easy for us to figure out the benefits and know exactly what we're going to do. Plan N has that same Part B deductible, so at first you pay $226 during the year, and then you have a copay. If you go to the doctor, it's $20. If you go to the emergency room, it's $50. So the difference between G and M is the deductible is the same, but then on N you have a copay of $20 and the emergency room $50. Now N also does not cover what is called excess charges, and this makes it a little gray on N, but it's really not a big deal as long as we understand it. So excess charges are when you go to a doctor's office, they either contract with Medicare as Medicare assignment or they just take Medicare. So if they take Medicare assignment, it means that they agree that they will take what Medicare pays them in full. If they don't take assignment, then they take what Medicare pays them and they can bill the client 15% above what Medicare pays them. Sounds like a lot, but it really isn't that much. So if you had a regular office visit and it was $100 and they didn't take assignment, they could bill you an additional $15. So I've been doing this quite a while. I've really never had anyone tell me they've had an issue with excess charges. So if it does come up, it's generally very small. So it's certainly something I'm comfortable with, using in the right situation. So when we're looking at Plan G and Plan N, where would I draw the line? When would I choose Plan G? When would I choose Plan N? Well, I would almost always choose Plan G if it makes sense, because it's so easy. We just have a small deductible and then it's 100% after that. So then it comes down to the financial side of it, the premium. So Plan G can be very competitive in a lot of areas. Sometimes it's a little more expensive in other areas. So what I want to do is really get a Medicare supplement plan, whether it's G or N, that's pretty close to $100 a month. And a lot of times we get it less than $100 a month. So if we had a premium for G and N was $25 less, I'm gonna buy an N. That's enough of a difference to have that copay when I go to the doctor. If I'm gonna save $300 a year in premium, I'm probably not gonna run that much up in copays going to the doctor unless I have something chronic. So if you go to the doctor a couple times a month, no matter what, and you know that that's going to be the case, then G is going to be the one that we're going to look at. If you're pretty regular and you go once a year or twice a year or anything just not expected, then N is a fantastic choice. And again, I would choose it if it's $25 less than G. So now how do we find what company we want to use? Well, that's what we do. We make it as easy as possible. And again, we're looking for value. I want to make it so that you get the best value on the Medicare supplement. So you can see here, we have access to every company pretty much in every zip code. So we are licensed in all 50 states. And this is what we do, is we help find the right Medicare supplement with the right insurance company. And I really only generally will use the name brand. So I don't want to go outside of the name brand. So we're looking at the kind of the big 5 or 6 that have been around forever and are going to be around forever. And you can see here, we run it based on your zip code, based on your age, and then we find the best value. And there are some discounts for household discounts, and a lot of household discounts, all you have to do is just live with somebody. So if you just live with somebody, we can get as much as 14% off the cost of our Medicare supplement. So again, we put all that together and make it as easy as possible. So certainly would appreciate it if you allow us to help you. That's how I make my living. Great thing is there's no cost to you to allow me to help you. So it's very easy. Whatever insurance carrier we choose, then they pay me to be your service agent now and in the future. So you'll have access to me in the future as well, because I will be your service agent going forward. So I hope you found all this helpful. And again, that's pretty easy to understand, and we'll make it easy to find the right one. And then we take care of it from there. We make it easy to get it put in place right when your Medicare is going to start, so everything just goes like it's supposed to go. So I hope you found this helpful. Take a look right now on how to download my book. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll find very helpful is, first, download a copy of my free book, Medicare Made Clear. I put a lot of time, a lot of effort into this book. You'll find it very helpful for everything that you need for Medicare now and in the future. It has videos in the book, has all the links that you need for signing up and everything else that you'll need going forward. So take just a minute, go to medicareonvideo.com/free book. You can download it right now and save it on your computer. You'll have it for now and in the future. And then down the road, when it's time to renew your Medicare supplement plan, we always want to shop around. So every year, it makes sense to do a Medicare price check. And I have a website specific to that, www.medicarepricecheck.com, where we will compare your current plan and see if we can get the same plan at a lower price. And a lot of times, we can do that. So it makes sense to visit medicarepricecheck.com every year. We'll do a quick comparison, let you know if it makes sense, and then we take it from there. I hope you found all this helpful. Have a fantastic day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please, download my book, watch some videos, subscribe to the channel. Have a great day.